Hi there. So I wanted to go live today because this month is BPD Awareness Month, or Borderline Personality Disorder Awareness Month. It's a very important month in the work that I do because DBT was designed originally for this population. And so I wanted to just provide a little bit of information about BPD since it is BPD Awareness Month. So one thing I think that's important to always go back to is that when it comes down to it, a diagnosis is just a list of problems and behaviors. And so we're going to talk, or I'm going to talk today about what some of those problems and behaviors are when it comes to BPD, just again to get that awareness out there and to sort of normalize this a little bit more. So there are 9 criteria to be diagnosed with borderline personality disorder, and you only have to meet 5 of them to actually get the diagnosis. And so it can look like many, many different things. There's a lot of stigma actually about this disorder, and a lot of judgments, which is hard for me, I think, because you only have to meet 5 of those 9 criteria. This can look like a lot of different things and a lot of different symptoms. So there isn't just one type of borderline personality disorder. It can look like a lot. And so I'm going to go through those potential criteria here today to bring some awareness to that. So one criteria is intense fears of abandonment. Sometimes that is, it involves pleading, threatening with someone when the person with BPD perceives that they might leave them. Another criteria is unstable or roller coaster relationships. So lots of up and down, stormy relationships, where maybe in one minute the person that the person with BPD might really, really love that person or feel very intensely about them, and the next want nothing to do with them or feel like they're terrible. Another criteria is sort of unclear self-image or an instability in that self-image. A lot of people with BPD don't really know who they are. And so they might have a lot of frequent changes in their relationships or their career goals, or their religious beliefs or their sexual identity or their friends or anything like that. All coming back to not really knowing who they are. Another criteria is self-harm and suicide attempts. And again, with these, they're not always there, but they're criteria that can come up. So oftentimes people with borderline personality disorder have made at least one suicide attempt in their life, or have likely engaged in some sort of self-harm, potentially without any intention to die, but just as oftentimes a way to find relief. Another criteria is pretty extreme emotional lability, emotional mood swings. I'm kind of going from one end to the other, oftentimes triggered by things in the environment. So oftentimes someone with BPD might fluctuate between feeling really anxious and then feeling really depressed, and then feeling really angry. And those emotions can come up a lot, and there's some neutral in there too, but those emotions come up and can be really, really strong. Another criteria that we see is chronic feelings of emptiness, and this is more than just numbness. This is like empty, feeling like there is a void that needs filled. There is something missing in their life that feels very painful. Another criteria is really explosive, intense anger. So this could look like getting angry at things that are, very, seem kind of trivial, but to this person, they don't. Hi, Charlie. It could be that when the person gets angry, it is that explosive where maybe it comes to hitting the wall, punching holes in the walls, breaking things, hurting other people. But it's very intense anger and hard to control. And then finally, and one that I have found is not as common and does come up, is that when the person with BPD is particularly distressed, they might feel paranoid or suspicious of other people, or actually kind of dissociate or feel disconnected from their body, or like things are not real. So those are the criteria of BPD. And again, I can't emphasize enough that with this we're looking at 5 criteria, and that could be any mix of what we have here. And truly, one of the big reasons that we have diagnoses and labels like these is to help inform treatment. And before DBT came around, a lot of people thought that individuals with BPD couldn't be helped. And they felt like that too. They felt hopeless. Their life is often miserable. They feel like a person with 3rd-degree burns, that everything hurts. And so back in the 70s, Marsha Linehan came up with dialectical behavior therapy, which is now the gold standard treatment for BPD. So I wanted to come out here and talk to you again about these criteria to bring this awareness to it. And also for any of you out there who are struggling with this, to let you know that there is a treatment there for you. We have a gold standard treatment. It is called DBT that has been shown time and time again in randomized controlled trials, which basically in the science world means very, very effective trials, that this stuff works. So if you are thinking that there's nothing out there that can help you, or that there's no treatment that can be helpful, or that things are hopeless and pointless, come talk to me. Let me talk to you about this, because I think that this is worth trying. And again, it is the gold standard. It is the treatment that can help. There's a treatment there available for you. So again, just bringing this back to awareness. Borderline personality disorder is a diagnosis that is often judged, misperceived, has a lot of stigma. Let's learn more about it. Let's be more compassionate. And remember that there is a treatment available. So thank you for joining. I just wanted to pay some special tribute to this month. Thanks.